Welcome back to my channel. Today let us have a discussion on epilepsy. Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizure or periods of unusual behavior, sensation and sometimes loss of awareness. So this epilepsy is a central nervous disorder, so it causes seizure and sometimes unusual behavior or loss of awareness or conscious, we can see, during the epilepsy. Types of seizure. Seizures are caused by abnormal electrical activity in the brain. There are two types of seizure. One is generalized seizure and focal seizure. In a generalized seizure, we can see total brain is involved, and in the focal seizure, we can see one part of the brain is affected. So this is a focal seizure. What are all the causes for epilepsy? There are brain damage or trauma during birth, genetic syndrome and conditions, brain infection or tumor, severe head injury and stroke. So these are all the main causes for the epilepsy. What are all the signs and symptoms of epilepsy? So there are loss of consciousness, weakness, anxiety, staring, contraction and jerking of muscles, confused speech. So these are all the common signs and symptoms we can see during a epilepsy. And what are all the phases of seizure? Tonic phase, clonic phase, post-ictal stupor. In a tonic phase, the patient will be straightening of body and limbs. In a clonic phase, clonic jerks of body, limbs and head. The tonic phase comes first. All the muscles stiffen, air being forced, fast the vocal cord causes a cry or groan. The person loses consciousness and falls to the floor. A person may bite their tongue or inside of their cheek. If this happens, saliva may look a bit bloody. After the tonic phase comes the clonic phase. The arms and usually the legs begin to jerk rapidly and rhythmically, bending and relaxing at the elbow, hips and knees. After a few minutes, the jerking slows and stops. The person's face may look dusky or a bit blue if they are having trouble breathing or the seizure lasts too long. The person may lose control of their bladder or bowel as the body relaxes. Consciousness or a person awareness returns slowly. These seizures generally last 1 to 3 minutes. Afterwards, the person may be sleepy, confused, irritable, or depressed. A tonic clonic seizure that lasts longer than 5 minutes needs to immediate medical help. What is the first aid for epilepsy or seizure? First and foremost thing is protect ill person from the injury. So during this convulsion or seizure, patient will not be having a awareness. Sudden fall will be there. So during that time, patient should not get any injury to, especially to his head. We should protect the patient from the injury and create comfortable condition or comfortable position to the patient. Remove everything from ill person mouth. If there is anything in a mouth, we should remove it off because patient will have aspiration. So we should remove anything is there in our mouth, and also we can put a mouth gag in our mouth to prevent tongue bite, and also flip ill person on its side after the seizure end. So we should make a patient in a lateral position once the convulsion ends. Stay near the ill person till awakening, and finally we should call for the medical help. What is the treatment for epilepsy or seizure? Doctors generally begin by treating epilepsy with medications, some epileptic medications. If medication do not treat the condition, doctors may propose surgery or another type of treatment. So usually they will start with the epileptic medications. With that also, if a patient is having a convulsions, they may suggest for the surgery. What is the nursing management during a seizure? The nursing goal is to prevent injury to the patient. This includes not only physical support but psychological support as well. Provide privacy during seizure or convulsion. Ace the patients on the floor if possible. Protect the head with a pad to prevent injury. Loosen constructive clothing, and also we can place a tongue blade between the teeth, and do not attempt to break open jaws that are clenched in a spasm to insert anything. No attempt should be made to restrain the patient during the seizure. Place the patient on one side with a head fixed forward. The patient should be reoriented to the environment and happening upon awakening. This is the normal EEG and partial seizure EEG and generalized seizure EEG. So the EEG looks like this if a patient have partial or generalized seizure.